Dylan. I'll be your nurse for today. So I understand that you can't speak or talk at the moment, so just give me a thumbs up for yes, thumbs down for no, and then raise both your hands up for me if you feel any pain or discomfort at all, okay? Is that understood? Thumbs up, yes. All right, so I'm gonna verify your name and date of birth here. So is your name Timmy Turner? Thumbs up, yes. Date of birth is April 20, 2000. Thumbs up, yes. Okay, I'm gonna go ahead and verify that here with the scanner. I'm gonna scan you here. All right, perfect. Looks like that matches up. So Timmy, I see that you don't have an allergy bracelet. Are there any allergies I should be aware about before I begin? Thumbs down, no. And then are you in any pain or discomfort at the moment? Thumbs down, no. All right, so what I'll be doing to you today is perform some tracheostomy care. What this entails, I'm gonna go ahead and perform some suctioning if I hear any secretions. I'm then gonna go ahead and change and replace that inner cannula, change and replace your dressing from underneath your faceplate. I'm also gonna go ahead and clean your faceplate as well as the surrounding skin around the faceplate. And lastly, I'm gonna go ahead and change your neck stabilizer. Does that sound okay with you? Thumbs up, yes. And then, have you had this procedure done to you before? Thumbs up, yes. Any pain or discomfort during past procedures like this? Thumbs down, no. And then do you have any questions or concerns before I begin? Thumbs down, no. So I'm gonna check your vitals here. It looks like your blood pressure is good at 120/80, heart rate's at 80. Your your respiratory rate is a little bit high at 24, and your O2 saturation is at 92%, which is a little bit low. So I'm gonna go ahead and perform some tracheostomy care on you, or perform some hyperoxygenation before I perform any suctioning, okay? Does that sound okay with you? Thumbs up, yes. And I do see that you have an increased work of breathing there. Are you having any difficulty breathing, coughing, or shortness of breath? Thumbs down, no to all those. All right, so I'm gonna go ahead and listen to your lungs right now. All right, so Timmy, as I go in each spot on your chest, just take a breath in and then a breath out, all right? All right, I'm gonna go ahead underneath your gown here, okay? In, out, in, out, in, out, in, out, in, out, in, out. All right, Timmy, so I did hear some secretions up in the upper airway there, so I will have to perform some suctioning on you today, okay? Before I begin any of that, though, I'm gonna go ahead and check if I have all my emergency equipment here with me. So I have my ambu bag connected to oxygen at 15 liters, running at 100% oxygen. I have my suction canister attached to the suction catheter there. I also have my suction catheter here. I have my inner cannula, and I have my two tracheostomies, one of a smaller size and one of a current size. I'm going to clean my hands again for 20 seconds. All right, perfect. Looks like I have all my supplies here. So I'm going to go ahead and clean my workstation now for at least 30 seconds. Okay, here we go. Okay, I'm also going to make sure to clean the sides of my table as well to make sure I have a nice and clean space here. Alright, perfect. Now that I have a clean space, I'm going to go ahead and take off these gloves. Clean my hands again for 20 seconds. I'm going to go ahead and wait for my table to dry for a minimum of 2 minutes. Close this curtain here to maintain patient privacy. Timmy, I'm going to raise you up to high Fowler's position. Perfect. All right, so I'm gonna go ahead now and clean my hands for 20 seconds, and it looks like my table has now dried for a minimum of 2 minutes. Go ahead and put these gloves on here. All right, so I've placed my supplies on the table. So with me here, I have my neck stabilizer. I have a bottle of normal saline. I have my suction catheter kit here, my inner cannula, and lastly, my tracheostomy care kit here. I'm gonna go ahead and take out my new suction catheter here. I'm gonna replace it with the old one, as I don't know how long the old one's been on for. Now that the suction catheter has been replaced, I'm gonna go ahead and adjust the suction to 120 millimeters of mercury. Now that that's been adjusted, I'm gonna adjust my O2 and my ambu bag to 15 liters, running at 100% oxygen. All right, so I'm gonna go ahead and test the functioning of my ambu bag here. And it looks like it's working just fine. So now, Timmy, I'm gonna go ahead and take a look at your O2 source here. And it looks like it's running at 6 liters, which was documented previously. That was ordered previously, so it looks like there was no changes there. Clean my hands again for 20 seconds. Alright, so I'm gonna go ahead now and open up my Trach here kit here. Okay, I'm gonna go ahead and toss out these gloves as I don't need these. I'm gonna go ahead and grab my sterile drape, only holding it from the 1-inch border. Perfect. Go ahead and grab it from the 1-inch border here. Okay, Timmy, I'm gonna place this on top of you here. Okay, is that okay if I place it right here? Thumbs up, yes, perfect. Okay, so I'm gonna go ahead and grab my inner cannula here. Go ahead and drop this into the kit. Okay, toss that. Clean my hands again for 20 seconds. Alright, Timmy, how you feeling right now? You still doing okay there? Thumbs up, yes, okay. Alright, so I'm gonna go ahead and take out my sterile box here, only holding it from the outside. I'm gonna go ahead and open this normal saline bottle here. Fill it up halfway. Fill this up a little bit as well. Perfect. So I'm going to test out the functioning of my catheter, suction catheter here. Only exposing a little bit of the line. I'm going to go and dip this in. Occlude the line. Looks like the suction shot up to 150, so I'm going to go ahead and lower that to 120. Okay, now that's 120 with the line included. That's what we need. Go ahead and place this back on the top here. Okay, so Timmy, I'm going to go ahead and perform the suctioning. So I'm going to go ahead and hyperoxygenate you first before I perform such. So I'll take off this O2 source from me here. Get my ambo bag. Go ahead and stabilize your plate here. Okay. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Okay, so I see that your O2 is shot up to 98% now, so I can perform the suctioning. Okay, I'm only gonna expose a little bit of the catheter here. 1 to 2 inches. Go ahead and place this in. I feel resistance. Okay, so I'm gonna go ahead and clean my catheter now. Alright, now my catheter is clean, and as I was suctioning, I made sure to not place the plastic onto the outside of the inner cannula there. I'm gonna go ahead and place your O2 source back on here, okay, Timmy? Okay, Timmy, so how was that? You feeling okay? Thumbs up, yes. Any pain, discomfort, or any shortness of breath at the moment? Thumbs down, no. All right, Timmy, so I'm gonna go ahead and just check your lung sounds here. Okay. So you go in each spot again, just take a breath in and a breath out. You go ahead and lift up your drape here from the 1-inch border. Go underneath your gown here. In, out. Okay. In, out. Okay, Timmy, so I did not hear any secretions up in the upper airway anymore. Your lung sounds are clear, equal, and bilateral, so it looks like I do not have to perform any suctioning. But if I were to have to perform suctioning again, I'd have to wait for at least 30 seconds before doing so. I'm gonna go ahead and clean my hands again for 20 seconds. Okay. Alright, Timmy, you doing okay there still? Thumbs up, yes. Okay, good. Alright, Timmy, so now I'm going to go ahead and change your inner cannula now, okay? So I'm going to go ahead and just grab with the non-dominant hand here. Okay, I'm gonna go ahead and grab your inner cannula, making sure to stabilize the plate here. Okay. I'm gonna go ahead and grab this new inner cannula, only holding it from the outside, just as so. I'm gonna go ahead and place the inner cannula in. Okay. And once it's in, I'm gonna go ahead and lock it with the butterfly clips on the side. Clip it in. Okay, I'm gonna make sure it's secured. Perfect. So now I'm gonna go ahead and take off your old dressing here. So I'm gonna do a site assessment, no redness, no swelling, no signs of possible infection. I see that the faceplate is intact and the inner cannula is also intact as well. All right, stabilizing there. I'm gonna go ahead and clean your site here. So I'm gonna dip this Q-tip in the saline. Go ahead and wipe. I'm gonna go ahead and grab this one here. And dip this in. Go ahead and wipe that. I'm gonna go ahead and dip this gauze here. Dip this gauze. Swipe. Toss. And dip this gauze in here. Swipe the top. You doing okay there, Timmy? Thumbs up, yes. Any pain or discomfort at the moment right now? Thumbs down now. Okay. Dip this in here. Go ahead and clean this side now. Okay. Go ahead and go on this side here. Still stabilizing the line. The faceplate. I'm going to go ahead and dry your faceplate here by tapping. Pat, 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 pat. I'm going to go ahead and get the other side here now, stabilizing it still. Pat, 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 pat. Toss that. I'm going to go ahead and grab my split dressing. I'm going to use my left hand now to open this up. Go back to stabilizing the plate here. Go ahead and place this underneath. Okay, go ahead and stabilize this side here. Doing okay there, Timmy? Thumbs up, yes. Any pain right now? Thumbs down, no. Okay, perfect. I'm almost done. Okay, looks like that is secured there. I'm gonna go ahead and place your O2 source back on here. So how was that, Timmy? Was that okay for you there? Thumbs up, yes. Any pain or discomfort at the moment? Thumbs down, no. Do you feel any shortness of breath right now? Thumbs down, no. Okay, so I'm all done changing your dressing, changing your inner cannula, and performing the suctioning. So I'm gonna go ahead and lower your bed down to the lowest position. Put your guardrails up here. I'm gonna place your collet right here. All right, so Timmy, I'm all done with that now. So I'm gonna go ahead and grab another nurse. So that way we can go ahead and take out the neck stabilizer and replace it with a new one, okay? Do you have any questions, concerns, or do you need me to get anything before I go right now? Thumbs down, no? Okay. So we're going to take off these gloves right now. Clean my hands for 20 seconds. Okay, I'll be right back, Timmy. Hello, so Timmy, I'm back again here with my fellow nurse, Gio. We're just gonna go ahead now and change your neck stabilizers, all right? We're gonna go ahead and clean our hands for 20 seconds. Okay, we're gonna put on some gloves now. All right, Timmy. I'm gonna go ahead and prepare the neck stabilizers here. Okay, and take out your O2 source here. I'm gonna start off by taking off this side right here. Okay. Perfect. And as I look on this side, I don't see any redness, swelling, any possible signs of infection there. Okay. Just step back here. Alright, we'll move this back here. And then Gio, can we lift lift your head up a little bit here? Alright, so I don't see any redness, swelling, or any signs of infection on the back of the neck as well. Alright. Let me move Timmy's hair out of the way here, I'm so sorry. Alright. Okay. Doing okay, Timmy? Thumbs up, yes? Perfect. Alright, any signs of redness, swelling, or infection there?
No.
Perfect. Alright, so let's do a 2-finger check here. Make sure it's not too loose, not too tight. Is it too loose, too tight on that side? Is it good?
That's good.
Perfect. Alright, so we're all done changing your neck stabilizers, okay? So I'm going to go ahead and put your O2 source back on here. Okay, perfect. Alright, so now that we're done here, I'm going to go ahead and take a look at your vital signs here. I see that your blood pressure is still good at 120/80, your heart rate is still at 80, your respiration rate is down to 18, which is perfect, and your O2 saturation is at 98%, which is great. So now I'm going to go ahead and check your lung sounds now. Okay, I'm going to go underneath your gown here. Breathe in, out, in, out, in, out, in, out, in, out, in, out. Okay, I'm going to take this out of your gown. Okay, so I don't hear any signs of secretions under there. Lung sounds are clear, equal, bilateral. So I'm going to go ahead now and lower the head of your bed here. Okay, go ahead and start cleaning up. Taking all these things I don't need. Okay. So Timmy, how was that again? That was okay? Thumbs up, yes. Are you feeling any pain or discomfort at the moment? Thumbs down, no. Okay, any difficulty breathing or shortness of breath? Thumbs down, no. Alright, so I'm going to leave your call bell light here. I'm going to make sure all your emergency equipment is still here. So I have your ambu bag attached to the oxygen, still at 15 liters. Your suction catheter there attached to the suction canister. So it looks like we have everything here still. Alright, so I'm going to go ahead and take off my gloves now. Wash my hands. Okay, so now that I'm done, I'm going to go ahead and document date, time. I'm also going to document the peristomal site assessment as well as patient tolerance of procedure. I will also document O2 saturation, vital signs, and the sputum's color, consistency, and amount. All right. Thank you, Timmy. I'll see you later.